Thank you for joining this educational webinar on some of the different ways that rural hospitals can incorporate data to drive immediate and long-term growth. My name is Trisha Young, and I'm the Regional Vice President of Business Development for Intellimed. Today, I'd like to share with you how community hospitals can incorporate data into their recovery efforts to drive immediate and long-term growth. Long before the COVID-19 pandemic, rural hospitals have struggled to remain financially viable within their communities. So let's address some of those universal challenges that all small hospitals face. Managing perceptions about quality of care. Compounding that, it is really hard to recruit and retain quality physicians and staff in rural markets. And across the board, regardless of the type of market you're in, we know that healthcare delivery is moving from the inpatient to the outpatient setting. And outmigration. Whether your patients are leaving due to the lack of services provided or a poor perception of care locally, how can hospitals capture more case volumes in their market? In spite of all of these challenges, data can help uncover opportunities to grow case volumes and develop services specific to the changing needs in your community. So how do we go about doing this? Today, we'll be looking at demographic trends, service line growth opportunities, and how chronic disease conditions within a community's population can shape your long-term growth using a combination of data sources. First, we'll explore demographic data. This is critical to identifying opportunities for growth within your service area by geography and age group. You can also look at socioeconomic factors like household income and education levels. All-payer claims data or professional service claims data. This is helpful if you're trying to identify underlying chronic conditions, service line trends, physician relationships, and referral patterns within your market. And lastly, discharge data. For this example, we'll examine both inpatient and outpatient data sets. If state data is not available in your market, Medicare data can be used instead. So for this example specifically, we're going to look closely at a 4-county region in northeastern Nevada. The first step here is understanding the demographics of your market. This allows you to align the services of what you provide with the current and future community need. The data here is centered on Elko, Eureka, Lander, and White Pine counties in Nevada, which make up almost a quarter of the state geographically. The source of the data here for the report is from Esri, and at Intellimed, we use more than one source for demographic data. One thing that we found is that in rural areas, company to company, the coverage varies. So if you're looking to incorporate demographic data, just make sure that you verify the coverage in your specific market first. The demographic snapshot aggregates the more detail-level reports about race, ethnicity, household income, and the age distribution of your market into one view. While all these factors are important to understanding your overall population, let's just focus on the current and 5-year trends by age group. So this market, like many other rural markets, is experiencing moderate growth with shifts in specific age groups. Here you can see the 20 to 29 and the 45 to 59 age groups are decreasing. Their 5-year projection is decreasing by 8%, and the collective loss in the 45 to 59 age group is going down by 3.5%. This is not ideal from a payer perspective because we know that the 45 to 64 age group is really the sweet spot for capturing commercial elective procedures. The data can still be used to identify opportunities for growth, even with these declines in the optimal age range and payer mix. When you take into account total growth, over the next 5 years, this market will increase by 4.3%. So what did the demographics tell us about this market? Population declines in the 20 to 29 age groups could point to a decline in OB cases over the next 5 years. Similar declines in the 45 to 59 age group could also indicate a loss of revenue for commercial elective procedures. The largest gains were in the 30 to 44 and the 60 to 85 plus age groups. So what can this market do to prepare for declines in certain age groups and increases in others? Building on these demographic insights, we are now going to look at claims data to see if there are any underlying chronic disease conditions within the age groups that are growing. Identifying this could show us valuable insights on how this market could adjust their healthcare offerings to meet the changing demographics. Traditionally, claims data has been used to show relationships between family practitioners and specialists. One of the most valuable roles that claims data can play for rural markets is when it's used to show recent chronic diagnoses made in the outpatient or office setting. So, getting back to our corner in northeastern Nevada, we are looking at professional services claims data for all diagnoses made within the last year in this 4-county region. I've sorted the data to show all chronic conditions, and all of my outpatient claims are categorized by the greatest number of claims by specialty physician quarter over quarter. So remember, our objective here is to see if we can identify any chronic conditions in this market that could predict future healthcare need. I've narrowed my criteria to just show the top 8 specialties. Looking at this trend line over the last year, the top diagnoses made roll up under the cardiovascular, pulmonary, and endocrinology specialties. Over here, all of the claims are broken out by diagnostic category and subcategory. So the top diagnostic chronic condition in this market is circulatory disease. And of those claims, the highest diagnoses made in this market is hypertension, followed by dysrhythmias and coronary atherosclerosis. The claims are also broken out by payer and color, so green for Medicare, blue for Medicaid, and orange for commercial. Over half of these hypertension claims are paid through a commercial payer, which indicates a younger, unhealthy population for cardiovascular disease. So when I select diagnoses of circulatory disease, I'm narrowing the data to just show those claims. If I move down here to the bottom right, this graph tells me the age and gender for all of the circulatory disease claims. Remember, our age groups that are increasing in this market are the 30 to 44 and the 65 plus age groups. Over here on the left, the map is telling me that the majority of patients are living in the Elko area, which is what I would expect, but many of them are coming from the outlying counties. So what did we learn by looking at the data in this way? The outpatient claims were able to show a high incidence of underlying chronic cardiovascular disease for this population in northeastern Nevada. The majority of recent cardiovascular diagnoses made were in the 65 and older age group that's expected to have the biggest population increase in the next 5 years. The second highest group with underlying cardiovascular disease is the 45 to 64-year-old population, which is expected to decline. The data also revealed that half of all hypertension claims were paid commercially, representing a younger, unhealthy population. All of these factors indicate that this market has a strong need for additional cardiovascular services. When used together, market-specific, demographic, and chronic disease incidence data can prove physician need and demand for services in your market to keep your patient population from outmigrating for care. In order to fully understand demand, you first need to understand your market. So let's take a look at the combined ambulatory and inpatient discharge data sets for the last 3 years in northeastern Nevada. At the top left here, we have all the facilities that are based in our 4-county area. Over here on the right, this shows service line performance for all facilities in this market over the last 3 years. We see we've got big losses in general surgery and orthopedics. And one of the biggest challenges that this part of the state faces is that many ambulatory and inpatient cases are outmigrating to Utah for care. We are seeing big year-over-year declines, especially on the ambulatory side. In spite of these declining volumes, it is still possible to find opportunities for growth if you align community need with service offerings. On the second dashboard, I've narrowed the data so that we're just looking at inpatient case volumes. The main facility in this market is Northeastern Nevada Regional Hospital in Elko. Overall, their inpatient service line performance has remained pretty consistent over the last 3 years. But if we select the cardiovascular service line down here, we can see that they've had strong growth from 2017 through 2019. In fact, their inpatient volumes have grown from 169 cases in 2017 to 250 cases in 2019. That's fairly significant for a rural hospital. So let's dig in and look at them to see if we can identify what they did to drive that growth. The physician operating dashboard shows us the group practices and physicians that are attributed to those increasing case volumes. Northeastern Nevada Physician Practices is the top group practice, and below we see that 2 cardiovascular surgeons, Dr. Badger and Dr. Vandergen, are contributing to the majority of this growth. Now we are looking at trended case volumes for the physicians with cardiovascular cases in this market. We know that these 2 physicians in particular were responsible for the majority of growth, so let's take a look to see what they've done. This is where the data reveals how this facility grew their cardiovascular services based on community demand. Northeastern Nevada Regional Hospital knew that they had a population with high underlying cardiovascular disease. The community held perception in Elko was that the best acute care was in Salt Lake City, which is about 3.5 hours away by car. Not convenient if you're having a heart attack. So what they did to try to meet demand and address poor perceptions of care is they hired an interventional cardiologist from the University of Utah in Salt Lake City. This hospital, with the help of Dr. Badger, began to offer procedures that could be done locally and develop partnerships with urban hospitals to address the long-term higher acuity cardiovascular cases that were coming from this market. So when we're looking at their overall case mix index down here, you can see that the increase in volumes is directly attributed to stents and cardiac cath procedures. This dashboard tells another success story about this hospital. In looking at the utilization of cardiovascular cases for the 2 main physicians, you can see that their average length of stay is significantly lower than the CMS projected length of stay for the same cases. A consistent lower length of stay means that this hospital has capacity for additional cases and isn't missing out on any missed daybed revenue. The chart on the right shows facility utilization for the 4-county area. The closest hospitals in their market are highlighted, and what this shows us is that they have a much better utilization rate than any of their nearby competitors for the same cases. After speaking to them, they attribute their success to the implementation of cardiovascular quality of care standards. As a rural hospital, they believe they have an advantage because they are smaller. So they were able to implement protocols and adopt to the changes more quickly than a larger hospital or health system would. The patient origin dashboard shows potential opportunity for this facility. Our data is still centered around the 4-county area, but now we're looking at all facilities in this region except for Northeastern Nevada Regional Hospital. We've also sorted the data to just include the cardiovascular DRGs that have been performed at this hospital over the last 3 years. Structuring the data this way allows you to see the outmigrating cases that the facility can handle, as opposed to focusing on all outmigrating cases that you can't. On the bottom right, there's an upward trend of outmigrating patients for cardiovascular care, and the patient origin map shows us that the majority of those patients left these zip codes and primarily went to Renown Medical Center in Reno, Nevada. For the last few years, they've steadily picked up cases from this market. This hospital faced many of the same challenges that a lot of rural markets experience. Flat or declining case volumes, poor perceptions around quality of care, and a large number of cases leaving their market for services in urban areas. Despite all of these challenges, they were still able to develop a service line that met the underlying needs of their community. When used together, demographic, claims, and discharge data can help hospitals uncover opportunities to align community need with healthcare demand. I think it's important to share some background information about this use case. When we started this webinar, Intellimed was looking to explore a market where we did not have a client. Our objective was to be able to demonstrate within a few minutes our data can reveal the underpinnings and complexity of a rural market, along with the hospital's response, without having any prior knowledge of the situation. So after researching this market, we immediately reached out to Northeastern Nevada Regional Hospital, and they were able to confirm our conclusions about what the data showed. Becky Jones, the director of cardiopulmonary services there, worked closely with her team and their medical director to develop the invasive cardiology service line for the Elko region. She was able to share some fascinating ways about how they address staffing and physician recruitment, the implementation of quality measures, and how they were able to form partnerships in this very rural frontier market. In sharing our findings with them, the data was also able to reaffirm their belief, which is that this market can support another cardiologist. When used together, Intellimed's inpatient, outpatient, claims, and demographic data can quickly uncover what's happening in a market. Over the past 38 years, Intellimed has worked closely with hospitals large and small to help assess their competitive landscape and to identify opportunities for growth. We've worked extensively with smaller hospitals, including Pratt Regional Medical Center in Kansas, and we understand the difficulties you face in your unique markets. With Pratt Regional Medical Center, we were able to use our data to help them identify local outmigration patterns, which showed a need for additional obstetric and pediatric services. Intellimed has recently launched Community Blueprint, a sophisticated, easy-to-use, and affordable suite of data solutions that include point-and-click applications like the ones I showed you earlier. This initiative was designed specifically for hospitals like yours and was made to be as accessible as possible. We also offer customized consulting options to help hospitals develop strategic plans designed to meet their goals. Intellimed has a dedicated support structure where you have one person that you can always reach out to for assistance. We provide in-depth online and in-person training, and we regularly check in with updates so that you get the most out of your data. Thank you for joining our webinar. Please feel free to reach us if you'd like to learn more about our suite of healthcare solutions designed for the rural market.